Are you a good rehabilitation clinician who is missing an essential tool? Rehabilitation clinicians undergo rigorous academic and practical training. But most of us were never really taught how to use brain imaging to make our assessments and treatments more targeted. Recently, I asked a group of clinicians how often they look at brain images. Some never look, some look occasionally, and only a few look regularly. Then I asked how confident they feel when looking at those images, and the answer was very clear. Clinicians may be looking at the brain images, but they don't feel confident that they know what they are seeing. The next question was even more important. Does looking at the brain imaging change your assessment, treatment, and discharge planning? For most clinicians, the answer was either no or they were not sure. This raises another important question. Why look at the brain images if they don't change what you do clinically? The interesting thing is that we know that imaging can change clinical practice. Orthopedic physiotherapists use X-rays, CT scans, ultrasounds, and MRIs to guide assessment and treatment. Hand therapists do the same. Speech pathologists use video fluoroscopies to understand swallowing and guide management. So why aren't neurorehab clinicians using brain imaging in a practical way? I know many rehab clinicians and they are good clinicians. The issue is that most were never taught how to use brain imaging as a clinical reasoning tool. Not for diagnosis, but to understand how the lesion impacts function, recovery, treatment priorities, and discharge planning. If brain imaging is not yet changing your assessments, treatments, and planning, it may be the essential tool that helps you upskill and improve your clinical reasoning. If you enjoyed this video, please like, subscribe, and share. And if you want to learn more about brain imaging, join me for the free 2-part case-based seminar series, which I'll be running live on the 24th of June and 1st of July. The link for registration is below.